The Kendall test is one of the tests designed to test hip flexor tightness. What you're going to do is you're going to have the patient completely on the table. You're going to have them flex their knees to their chest. Hold their knees to their chest. You're going to have them, whichever leg you're testing is the leg you're going to let back down. So I want you to hold your right knee to your chest, okay. Let your left leg go, and they're going to bring their left leg down. And what you're looking for is whether or not it's held off the table. In a normal test, right now, it's flat. It's on the table, so her hip flexors are fine. If this were a positive test and she had tight hip flexors, when we would let her down, you would see it off the table. That would be indicative of really tight hip flexors. The Thomas test is another test designed to measure the tightness of the hip flexors. Similar, it's the exact same motions as the Kendall test, except for this one you're going to have the patient at the edge of the bed. Given you want to try and do it on a bed or a table that's really solid. This bed is soft, so it's hard for her to keep her balance, but we're going to do the best we can. So you're going to have the patient lay back, pull their knees to their chest. And I should note that while you do this, different than the Kendall test, with this one you're going to take one of your hands and put it under the small of their back, and you're feeling for lower doses. Now, just like the Kendall test, I'm going to have her drop this leg all the way down. Negative test, it drops parallel or below. That means her hip flexors are fine. If it's a positive test, she would be up because her hip flexors are tight, so it's pulling her leg up. You can let it down. Now, what I'm feeling for with my left hand under her back is lower doses. If she arches her back in an attempt to like keep her leg up, that means that it's a false test. That means she's cheating. So we want the small of the back flat against the table.